See the slideshow with kind of like a picture of me climbing up a thing with no skin on my back. Don't laugh, Miss Harper. It looks just like me. Okay. All right. Cool. By the way, the major muscle that this guy is using to climb up the mountain right now is the Latissimus dorsi. When you see bodybuilders and they do that thing like this and they look like a cobra and they spread their wings, that's their Latissimus dorsi. It is the massive V-shaped muscle in your back, right? And muscles can only do one thing. Miss Nguyen, muscles can only do one thing. What is the one thing that muscles can do?
Connect together.
They do connect together. That's good. But they can only...
I don't know how to talk that. But I think it's the same in the all together now.
Yes.
I don't know how to.
Yes, thank you. No, that's good. They can only come together. That's very true.
Yeah.
They can only contract. They can only pull. They can only come together. They can only shorten on their own. By the way, something else can lengthen them again. Don't get me wrong. But their power can only pull, can only shorten, can only contract. So when this guy's got his arm way up there, his latissimus dorsi runs from here to here, right? If it shortens, what's going to happen to my arm? Anybody? This latissimus dorsi shortens, just in layman's terms, like what's going to happen to my arm? It's going to come down.
Pull down.
Thank you very much. It is going to pull down. Yes, that's exactly right. Now we have some fancy words for pull down, right? If I am pulling down to my side, what do we call this?
Adduction?
Adduction. No, you are right, Miss Monreal. You are right. It adducts my arm. It adds it back to my body. And if I pull down in front, what am I doing? Same muscle, by the way, does this.
Flexion?
Not pushing up.
No.
Abduction.
No.
Extension.
Extension. So the latissimus dorsi, one of the main things it does is to, as Miss Monreal says, is to pull your arms down. But when I pull my arms down from the outside of my body, that's called an adduction. When I pull them down here, it's called an extension. Extension, right? If I was going up, that's flexion. But anyway, so latissimus dorsi, because it pulls, you don't have to memorize this, because it pulls, you know it's going from here to here. That's an extension. That's an adduction. Those are the two main things it does. We'll talk about some other stuff. It is a powerful adductor and extender of the humerus, of the glenohumeral joint. It depends on how you want to say that. But it is a powerful puller downer. Yes. Okay. So, hopefully you can all see this diagram at the back. Don't get overwhelmed by it. We're not going to talk about all of it now. Don't even worry about that. But I want to tell you how to look at this diagram. The right side looks very different from the left side because on the right side they've torn off even more muscles. So muscles in your body are in layers, right? And what they're showing you on the left side, they're showing you half of the trapezius. Not all of it, half of it. There's another side that they've removed to show you things like the rhomboids major and minor underneath it. That's why the picture looks different on both sides. They've cut away stuff from one side or the other. So the side that I believe you see is the left, I hope, has the trapezius on it. Yeah? Actually, maybe for you guys, would it be this side?
If it helps, it's on page 61.
61, yep. And it should be in your slideshow.
Yeah.
Good. But it is on page 61, yes. I'm just trying to tell you how to read the book a little bit here, because it's a little bit confusing. So, I'm sorry, what?
I said, I do see it on the left side.
The trapezius, good. The reason you don't see it on the right side of the picture is they've removed the trapezius to show you the muscles underneath. Okay? That's why. So most of these pictures in your book are only showing you half the muscle so that they can show you more stuff. So if you look at the left side of this, you can see the trapezius and the deltoid. If you look at the right side, they've removed the trapezius and the deltoid to show you the stuff underneath. Yeah? Okay. What I do want you to notice about the trapezius in here is it's actually much larger than we think. It doesn't just run down here, it runs halfway down my back. It makes kind of a diamond on somebody's back. This is just a side view. I do want you to look at the side view here and notice how big the latissimus dorsi is. It essentially comes from your butt, essentially, all the way up to your arm. It is really this huge slab of muscle. It's very thin on most people, but it's big. It's big. And think what the word latissimus and dorsi means. Latissimus means lateral. Dorsi means dorsal. It's the lateral back muscle. Latissimus dorsi. The lateral out to the sides, dorsal muscle, back muscle. The lateral back muscle. Does that make sense? No? Anybody? Thank you. One person. Thank you.
Can you repeat that?
Yes. So latissimus dorsi. The word latissimus dorsi. Latissimus sounds like lateral. Part of its Latin derivation is lateral. And lateral means to the outside. Medial means to the inside. Lateral means to the outside. So lateral. Dorsi comes from dorsal. Dorsal means back. So this is the lateral back muscle. The muscle on the back and the sides of my body. They're describing the location. Does that make sense? Good. Good. I'm just giving you ways, by the way, to think about these and to remember them. Because if you just try to straight remember muscles and their actions and all that kind of stuff, it's going to be really difficult. I'm not smart enough to do that. Some of you are, but I'm not. So I'm going to show you what I do, which is kind of learn what the words mean and kind of figure out the actions on my own so that I don't have to memorize actions for a whole bunch of muscles. Because I know all muscles can only do one thing, which is pull, contract, shorten, come together. But those are all the same thing. And so once I know that, once I know where the muscle runs, I can figure out what it does. Cool. If you'll look, what is right above the latissimus dorsi? What is superior to the latissimus dorsi? Teres major. Yep. Anytime I say latissimus dorsi, you say Teres major. Thank you. If these weren't colored in different colors in your book, do you see how you could just think the teres major was more of the latissimus dorsi? Kind of like the top portion? Yep. It's going to the same place. It's going to do the same thing. It's much smaller. It doesn't go all the way down to your bottom, but it looks just like it's another top part of latissimus dorsi, and it acts that way. That's why we lump them together. And if you were rubbing in that area, human beings aren't colored like that, right? They don't have clean distinctions between their muscles and such, right? Everything kind of grows together a little bit. So you would just be rubbing over both those and you wouldn't know. And that's fine. In this case, it wouldn't matter because we'd rub them both. But that's why we put them together, if that makes sense. Just a front view here. Front view. We'll come back to this. We'll come back to this. Let's. I think we're going to come back to this too. Bear with me a little bit here. Okay. Just want to make sure we get traps in here. Well, No, let's go forward. Sorry, guys. I don't want to confuse you. I want to talk about these first. Let's talk about the muscles separately first. We're going to cover 4 muscles today. We're going to talk about them separately. But you got to remember something. Muscles almost never act alone. Muscles almost never act alone. So some of the stuff I'm going to say might sound confusing because I might say, hey, a muscle can do this or this, and you're going to be like, which one does it do? Well, it depends on what other muscles might be helping it. Right? So if I have a muscle that pulls this bone up every time, but there's another muscle over here that pulls it this way, the bone can do different things depending on which muscles are helping each other. And when muscles help each other, we call them synergists. They work together in synergy. But so just remember that you've got lots of stuff pulling on your bones. You're not a simple creature. It's very unusual that you use just your deltoid. In fact, I'm not even just using my deltoid right now. I'm using my supraspinatus and my deltoid. And there's a whole bunch of stabilizers going on, all sorts of stuff. So we are breaking this down in very simple terms right now. We're pretending like these muscles are going to work all on their own. Okay? So can everybody see a picture of the deltoid here? Good. Can everybody see a skeleton? Good. The deltoid fits on the skeleton like this. Yeah, thank you. That's what I was wondering too. There. The deltoid lays over your arm like this. It wraps a little bit from back to the side to the front. Yeah? Cool. When we talk about back, side, and front, we use those fancy words that we learned. We use posterior for the back, lateral for the side or the middle part of the muscle, and anterior for the front. Don't get too confused. Anterior just means front. Posterior just means back. Middle just means middle or lateral, which means side. But they're just different words for something you already understand. You know this is the front of the body. But we call this the anterior part of the deltoid because the deltoid wraps around the shoulder. So it's got thousands of little contractile tissues, hundreds of thousands, wrapping around the shoulder. And even though we give this thing one name, it does not mean that the whole thing works together all the time. Sometimes the back muscles just hang out here and don't do anything. Sometimes the front ones work all by themselves, things like that. But we have posterior fibers, anterior fibers, and middle fibers. Posterior fibers to this muscle, middle fibers, anterior fibers. Yeah? So, Ms. Torres, which fibers would these be that I am touching right now?
Posterior fibers?
Posterior fibers is absolutely correct. Thank you.
Thank you. Yeah. Sorry, it just takes too long.
No, it's okay. It was just, don't worry about it. We're all good. Miss Petrie, which fibers would these be?
Middle fibers?
Thank you. Miss Cooper, which fibers would these be?
Let me pin you to my screen.
Okay.
You're tiny. The lateral
Not these. These.
fiber. Oh, posterior or anterior?
Thank you. Anterior. And what does anterior mean?
Anterior.
What does anterior mean?
Anterior means like front in front.
That's it. Front. Thank you. Cool. Okay. Miss Monreal. Muscles can only do one thing. What's that?
Contract.
Cool. What fibers are these back here?
Posterior.
Yes. if they contract, what's going to happen to this arm?
Retract.
Good guess, by the way. Retract is a good guess because if this was the scapula, you'd be right.
Okay, so are you just talking about the whole arm then?
Yeah, just this motion. What's that?
Well, it's just like I can't see you because your screen is frozen. So
Oh!
I'm trying to guess at what you're doing.
Oh my God, I don't even know how to describe what I'm doing.
Okay, you're moving now. You want to
good.
show me again? Extension?
Yes! The posterior fibers extend. You don't have to memorize that. You can see it. Thank you. Thank you very much. Miss Hunter. Miss Hunter, which fibers are these?
Please repeat the question.
Which fibers are these? Which portion of the muscle is this?
Is that the lateral?
Yes. And in your book they call it, but you're 100% right. But in the book they call it the middle fibers because they're between the front and the back. But you are right. They are the lateral fibers.
Okay.
So if these middle or lateral fibers contract, what's this arm going to do?
Is that a abduction?
It is an abduction all day long. Thank you very much. Miss Bilotic, which fibers are these?
Give me 1 second.
Yeah, no problem.
The anterior?
They are the anterior. They're ones in front. And if these contract, what's going to happen?
We're gonna flex.
They are. They're going to create... No, a flexion. You're right. They're going to create a flexion. You're 100% right. Stick with your first answer. You're going to create a flexion. Beautiful. So, what I'm going to say right now might sound really simple, but I want you to think about it for a second. Actually, Miss Waite, can you come over here?
Yes.
I want to show you something on Miss Waite. I'm trying to get you guys to think about actions without having to memorize them. Okay, a couple things. We can see you. Good. That's what they see.
Okay.
All right. So, I can only pull. I'm a muscle right now. I can only pull. All right? If I grab Miss Waite,
Do it.
thank you. I can only bring her here. I can only pull her. If I want to get her over there, this muscle cannot do it. I have to be over here to pull her over here. The reason I'm telling you this is think about this for a second. If I'm a muscle and I want to get her arm to go forward, I have to live in front. I can only pull. So muscles in front tend to pull in front because that's all they can do. If I want to get her arm to go back, I have to live back there. I'm a muscle who lives back here. So I'm going to be her rear deltoid right now. I'm going to be her anterior deltoid right now. I'm going to be her middle deltoid right now. If I want to move the arm out to the side, which is abduction, I've got to live on the side. I can't pull unless I'm in front of it. Does that make sense? Yeah? Good. So I never memorize my actions. I'm just like, golly, there's a muscle here. If it's shortened, that's what would happen. Golly, there's a muscle here. If it's shortened, that's what would happen. Golly, if there's a muscle here, if it's shortened, that's what would happen. Thank you.
You're welcome.
Thank you. So, I literally, this is so stupid, but it's so true. I imagine two little elves here with ropes between them. I'm not kidding you. I really do this. And I'm like, okay, these two little cute elves are pulling that rope together. And if that rope comes together, it's going to shorten and my arm's going to do that. If it's my anterior, it's going to come here. Middle, posterior there. Now, by the way, this works all the way out here. This is still an extension. This is still my rear deltoid pulling this back. From here, I am now flexing. This is all anterior deltoid. This is all three of them, by the way, but mainly the middle one. but all three are pulling here to pull this out to the side. Those are the actions. I'm making a really big deal about the actions because the actions are actually the most important thing about muscles, right? Like if you like to eat steak, the most important thing about muscle is it's delicious. But if you're working on kinesiology and being a massage therapist, the most important thing about a muscle is what it does. How do I move my arm out to the side? And so now you know that one of the muscles that helps you move your arm out to the side is your deltoid, especially the middle fibers, because they're in the perfect place to pull the arm out to the side. Yep. Cool. Let's talk about some of the other actions that are a little bit trickier to get, but it still works on the exact same principle. The exact same principle. If I have this muscle in front here, my anterior deltoid, it's running a little bit diagonal. So if it shortens, the other thing that's going to happen is you're going to get a little bit of this rotation inward. A little bit of this rotation inward. Miss Harper, do you remember what a rotation inward is called?
Rotation in, retraction?
Rotation in towards the middle. Rotation in towards the midline. It's not lateral, it's
Rotation horizontal.
medial.
Medial.
Medial rotation. Medial rotation. Don't be hard on yourself. Remember I said all that confusing action stuff, we were going to go over it again and again and again, and we had to apply it to muscles to make sense. We're starting to do that. We're starting to take this mishmash of information you guys got, and we're starting to put it in action in real life. And so it's going to take a while, especially with the first couple of muscles, right? Then after that, you guys are going to be like, oh yeah, don't worry, okay? So these anterior fibers can also kind of roll my shoulder in because they're running diagonal here. And so if they pull, yes, they lift up, but they can also roll my shoulder in a little bit. The posterior fibers run diagonal too, so if they pull, they can roll my shoulder out a little bit. Miss Felix Osuna, what do you call it when my shoulders roll out?
Lateral rotation.
Lateral rotation. And which part of the deltoid is doing this?
Is it the belly of the deltoid?
It is in a way the belly of the deltoid. The posterior deltoid. Posterior deltoid. Think about it. When I roll out, I'm kind of rolling to the back, right? And so I have to be behind to roll out to the back. If I'm rolling to the middle, it's kind of like rolling to the front. And I have to be in front to do that. So anterior fibers are going to tend to pull in medially. Posterior fibers are going to tend to pull out laterally. Does that kind of make sense?
Yes. Thank you.
Cool. I also meant for everybody, though. Does that make sense? Yes? Not getting, can you come back up here one more time? Not getting enough head nods. So I'm just going to go over it one more time because it'll make your life so much simpler down the road. Put you right here. Back up. Go ahead and pin us on the screen. If I want to roll her shoulders in, I can't do it from back here. That's going to roll them back. That's going to laterally rotate them. I have to do that from the back. If I pull her from the front, that's going to immediately rotate her shoulders. That's going to be, sorry, our boss was waving us. That's going to immediately rotate her shoulders. Because I have to be in front to pull them in. And I can't push them back. I've got to be on the back side. The posterior fibers to laterally rotate. Does this make sense? Does that help? Yes, thank you. Sorry.
No, that's okay.
She's always really nice. She lets me like drag her around and pull on her.
I know, but it's kind of fun, like when you're talking about the medial, to see what your whole arm does. I don't know if you guys can see me.
Yeah, you can go back further.
Okay, so when you're doing the medial rotation, it's the whole thing, like
It drags the whole thing
rolls
along, yes.
towards the end. So just like that, overemphasize when you're picturing it.
Yes. Overemphasize, you mean when I'm demonstrating it?
Well, like in your head when they're doing it on
Oh.
themselves, I mean.
Yes. By the way, it's your choice But I see a lot of you trying to understand movement by doing this. When there's no movement occurring with you whatsoever. When you say medial to yourself, or I show you, you might want to roll your shoulder in. When you say extension, you might want to extend with your posterior fibers of your deltoid. Or you might want to flex with your anterior fibers of your deltoid. Or you might want to abduct with your middle fibers, all the fibers actually, but the middle fibers mainly, of your deltoid. You might want to move your body because it gets the information into your brain another way. And you're eventually going to have to move somebody else's body. And you can actually feel, by the way, the fibers engaging. My deltoid feels soft now. Now it's hard because it's lifting my arm out. Yeah? Okay. So we knew those actions just because we kind of knew the way the fibers ran on the shoulder. And then it's grabbing onto the humerus, literally grabbing onto the humerus. Boom, boom, boom. I think this is the left, yeah. So left, here we go. If this was a deltoid, it'd be down like this. The front fibers would kind of grab up here and pull it this way. These middle ones would pull it out this way, and the ones behind would pull it back. So they don't always all work together. Sometimes they work separately. And your brain's smart. Your brain's amazing, actually. When you guys decide to lift out your arm, your brain is actually sending thousands of signals like pull these fibers, don't pull these fibers, don't pull them too much. You don't use all your fibers when you lift your arm out like this. The fibers in your muscles, there's hundreds of thousands of them, depending on the size of the muscle. And basically the fibers pull all out. They give 100% when they pull. So your brain doesn't activate all of them. Because if it did, you'd lift up something light like this and you'd throw it in the air. You'd have no control. So honestly, when I lift something like this, my brain says activate 25 fibers. When I lift something like this, it says activate, 10,000 fibers. Or 100,000 fibers. It chooses which fibers to activate. It does all that for you, by the way. You kind of learned that stuff a long time ago when you were a kid learning to crawl and walk and all that stuff. Your brain started to figure out how to activate stuff to where it's unconscious for you now. So now you tell your brain lift and you lift and you decide automatically on the amount of power, and your brain takes care of the entire sub-program. And the sub-program is huge. So I'm making a big deal out of this because this is important too. Because you have some base memories in how to use your muscles. This is just like psychological challenges too. You know, if you've got PTSD over something, it's because you have a base memory, a base program that automatically can get triggered and run, right? But you can do this with your posture too. You can learn certain behaviors that are automatic now and need to be reset sometimes. We'll get to that later though. Okay, so we've got the deltoid. Yes? Mr. Kandaris, what are the three portions or sections of the deltoid, or the three fiber sections of the deltoid? Mr. Kandaris, sir? Mr. Kandaris. Okay. Miss Stanley, what are the three sections of the deltoid?
The three sections of the fibers?
Yeah.
The posterior fibers, the middle fibers, and anterior fibers?
100% correct. All day long. Thank you very much. Miss Hanson, what are the fibers of the deltoid that are found in front? What are they called?
Anterior.
Thank you. What does anterior mean?
Front.
Thank you. What are the fibers that are found on the back called, Miss Hanson?
Posterior fibers.
Thank you. What does posterior mean?
Back.
Yes. And what are the fibers found on the side called?
Middle.
And what does middle mean?
Middle.
Yeah, it literally means the fibers between the anterior and the posterior ones, the middle. Yeah. I realize these questions are rudimentary, but I'm trying to burn stuff into your guys' brain. By the way, I'm not trying to talk down to you or anything. Thank you. That's exactly what I was looking for. Thank you. Miss Yanis, if I wanted to perform an action in front of my body, forget that this is called a flexion. I don't even care what it's called. But if I want to move my arm in front and I'm going to use the deltoid to do so, which fibers am I going to use?
The anterior fibers.
And what does anterior mean?
Front.
So if I want to move my arm in front, I use front fibers. Huh. Wow, thank you. And if I want to move my arm in an extension backwards, which fibers would I use, Miss Giannis?
Posteriors.
Posterior. What does posterior mean?
Back.
Back. So if I want to pull something back behind me, it's got to be behind me. Very, very cool. Thank you very much. That's exactly what I'm looking for. And since you're on a roll, Miss Giannis, if I wanted to move my arm out to the side, which happens to be called an abduction, which fibers would I use?
The middle fibers.
The middle fibers. And where are the middle fibers found on my body?
In the middle of your deltoid, between
Yeah.
the anterior.
Absolutely. Between the anterior, that's what middle means. And they're on the side of my body so they can pull stuff out to the side. Beautiful. Thank you. Do we kind of see how this works a little bit? Yeah. It's really cool because I know I'm making a really big deal out of this, but I go with other massage therapists who are like, oh, I don't know the action of that thing. And I'm sitting there thinking, how can you not know the action? All you have to do is imagine it pulling. Like you guys will, and that's kinesiology. That's the basis to all kinesiology that we're going to be learning. And postural analysis and everything is understanding this concept. So I'm going to be beating this in the ground for 8 months. But you will know your actions forever, for the rest of your life. You won't have to memorize them. Believe me. Assuming that you know the origins and insertions. So the deltoid's kind of easy to see. You can kind of see that it goes from here to here, and you can kind of figure stuff out. But we are going to talk about origin insertions really specifically so that we really, really understand them. Okay? Remember that origins and insertions are just where the muscle starts and where it ends. That's all they mean. Origin is usually the part that doesn't move a lot, and insertion is usually the part that does move. Here's what I mean by that. The origin is the stuff up here, the top part up here. This part doesn't move a lot. The insertion is the deltoid tuberosity in your humerus because it's your humerus that moves. It's generally the insertion that moves towards the origin. That's just the way they labeled those words to mean. To me, they're all attachments. This is attached to this. They are attachments. An origin is an attachment, an insertion is attachment. So sometimes you'll actually hear me just say attachments because I don't care actually. I know these two spots have to come closer together to figure out the action. I don't care really which one's the origin, which one's the insertion. But in general, origins are the part that don't move and insertions are the part that get pulled to the origin. So the origin tends to be the more stable area, right? The arm's flopping around here. We're going to pull it to these areas, right? And the origin is the anchor, right, that we're pulling from. That's generally how it works. Just don't get too tied up in that. Okay. So, Miss Nguyen, don't worry, you're smiling already. Don't worry. This will be hard to say, but the answer is right in front of you. Do you see the O on the slide that's in a box? It's the letter O.
Yeah.
Okay. That
Yeah.
O stands for origins. This is where the muscle starts. This is where it originates. Can you read the word? Yes, can you read the words next to the O? They're going to be hard to read, I know. I'm sorry.
Yeah. Orange in the mid and the start for in the start for in the up. I don't know how to say.
No, the stuff right next to the O, so where it says lateral 1/3 of the clavicle, acromion, and spine of scapula. I want you to just say what I said. Lateral
Lateral
1/3
lateral
third
third
of
of
clavicle,
clavicle.
acromion. Just say acromion.
Medium
Yep, that will take it. And
and
spine
spine
of
clavicle,
scapula.
scapula.
Scapula. Good. Good. By the way, what you're doing is very brave. Nobody wants to say these words out loud, right?
Yeah.
We all
No,
sound funny saying them. You're doing great. You're doing great. So let's talk about what she just said. Let's talk about what she just said. Miss Hunter, what bone is this?
Is that the clavicle? Is that the clavicle?
Yes, ma'am, it is. It's the clavicle. Thank you. Very well said.
I can't really see. Is that the clavicle?
It is.
Yeah. Okay.
You're dead on right. That's the clavicle. You did great. So the clavicle kind of has, we have to be able to talk about one end or the other. And sometimes we talk about the sternal end, and sometimes we talk about the acromial end. But we can also use words like lateral and medial to talk about the clavicle. If I'm using words like lateral and medial, which end of the clavicle is this? Is this the lateral or the medial end of the clavicle?
The medial.
It is the medial.
The medial.
The medial, cool. And what does that make this end of the
The
clavicle?
lateral.
The lateral. So when your book says lateral 1/3, oh wow, I just broke our clavicle. Okay. The book says lateral 1. I'll have to fix this in a second. I just broke our skeleton. But anyway, if you divided this into thirds, it's saying give me the lateral 1/3. It's saying the muscle starts attaching right here. It's just a way for it to describe what part of the bone it grabs. Because the deltoid does not grab the entire clavicle. It starts right from here. It grabs on to the lateral last 1/3 of the clavicle. Yeah. And, hold on. Sorry, I'm trying to fix it. There we go. Okay. Miss Hunter, one more question. This is the lateral 1/3 of the clavicle. Of the posterior, middle, and anterior fibers, which of those three fibers do you think attaches to the lateral 1/3 of the clavicle? The posterior, middle, or anterior fibers?
Which middle?
So right here in front, which of the three fibers do you think attach here? Because the clavicle's in front.
Is that? I was gonna say middle, but I guess lateral.
Well, no, both those terminologies are correct, but this is in front. What's the word for in front?
Oh, anterior.
Yeah, anterior. By the way, Miss Hunter, and all of you, I'm asking you questions I've never asked you before. I'm asking you to process information in a way I've never asked you before. So part of it is it's very hard for me to ask the questions in a way that makes them clear, and you're learning too. So you guys are doing great. So yeah, it would be normal to find the anterior fibers on this anterior portion. If we round the corner, the clavicle turns into the acromion process, which is on the lateral side of your body. And that's the second origin there. It says lateral 1/3 of the clavicle, and then acromion. They mean the acromion process, right here. Yeah. Cool? Ms. Torres, which of the three fibers do you suppose attaches to the acromion process mainly? The anterior, posterior, or middle fibers? Ms. Torres.
What was the question again?
So, we're still talking about origin. We just kind of passed the fibers here for the lateral 1/3 of the clavicle. We're on the acromion process here. Of the three fibers, the anterior, posterior, and middle, which do you suppose attaches here, has an origin here?
The middle.
The middle. You're 100% correct. Thank you. So this thing comes rounding around the back side, and it goes to the spine of the scapula. That's the third thing it says. Spine of the scapula. Yes. Miss Petrie, which fibers do you suppose attach to the spine of the scapula?
The posterior.
Posterior fibers, yeah. And can you see that the spinous scapula is here and the arm's here, so those fibers run kind of diagonal here. My hand is actually pretty close to mimicking the posterior fibers. And that's why if these shorten, the arm goes back, but it also, if these shorten, it can laterally rotate because it's pulling diagonally back. So now we can kind of see how this thing starts out where it's anchored. And so all the book is describing to you is the attachments up here that they call the origins. The origin, where this muscle starts, is the lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula. And do you remember our bony landmarks and trails? If I trace my finger here, like muscles don't jump, if I trace my finger here, it just follows lateral 1/3 of clavicle, turns into the acromion process, spine of scapula. That's where it anchors. That's the anchor. That's where your deltoid starts from here. Knowing this helps you be a better massage therapist when you go to massage it. All these fibers, by the way, come down very conveniently and insert into a bump on the humerus. Miss Cooper, do you see, hello, do you see the I on the screen there, underneath the O on the slide?
Yes.
The I stands for insertion. It's the attachment where they all insert. What is the I for the deltoid?
Deltoid insertion?
Well, but just read right next to the I there. Deltoid what?
Oh, sorry. I have to unpin you. Deltoid tuberosity?
Yes. And literally she just named the bump on the humerus. This bump is called the deltoid tuberosity. All the fibers go down to that bump. So we just told you the starting and end points. And that's how we figure out actions. We know it starts here, we know there's an end point here, and we can figure out if it pulls in certain directions, what's going to happen. And for the rest of your life, we want you to know the origin, insertion, and action. I argue that if you know the origin and insertion, you always know the action. Right? And I argue that because if I asked you right now, if I have an origin and I said, what's going to happen when I pull this skeleton? Everybody, all of you know the skeleton's going to come here. You know it's not going to go over there because I'm not pulling from over there. That's just impossible. Life doesn't work that way. And you know if I was back here and I pull it, it's going to come back here. Things come to where they're being pulled to. Your muscles are really like little elves with ropes. And if the muscle's here, it's going to pull the bone this way. Every time. Every time. There's no exceptions. Because they can't push and I can't pull something to where I'm not. If I told you I was going to pull this skeleton over there, you'd be like, no, you're not. You could push it over there, but muscles don't push. So you can only pull it this way. So I know that when I have a deltoid hooked to the front of my shoulder here and hooked to my arm here, and it pulls, I know we're going to get a flexion. I know. And when I know it's going a little bit diagonal, I know it can also medially rotate. It can kind of pull this in. You must visualize that. You can do it to yourself. I see people do it on tests. I love it. Yeah, I look over there and there's students in there and they're going, right? Now there's one other action that the anterior fibers of the deltoid can perform. If my arms are out like this and my anterior fibers contract, what is this action going to be? Ms. Monreal, do you know if my anterior fibers of the deltoid contract right now, what's going to happen? If they shorten here when I'm horizontally out, what's going to happen?
Horizontal adduction.
Yes, you are 100% correct. They are going to horizontally add my arm back in. These fibers can, because you can see them, they're going over like this. They're going to pull and shorten. They're going to grab your shirt like this. That's what's going to happen. There is no other choice. And that's how they get the horizontally adduct. If my arm happens to be out, which takes other muscles and actually even part of the deltoid, but don't worry about that, and the anterior fibers contract, it's going to pull it like this. Which means if the posterior fibers contract, what's going to happen, Miss Bilotic? The posterior fibers contract. What's going to happen if my arm's out horizontally the posterior fibers contract the fibers in back, what's going to happen?
They're gonna
They're going to what?
shorten. Like
They are going to shorten. You're 100% correct. They are going to shorten. But what's this movement called when my arms move back horizontally? Away. This was horizontal adduction. This is horizontal what?
adduction.
Abduction.
I'm sorry.
Adding together, AB taken apart. Good. This is good. Sorry, it's because I'm yelling. Okay. One last thing on here that will never be on a test. You do not need to memorize. I just want to make sure you understand it. There's also an N on this slide. N stands for nervation. And that means, what's the nerve coming from the spine that your brain uses to send signals to this muscle? And it says C5 and 6 there. What does C5 and 6 stand for? Anybody?
The spine.
The spine. What's the C stand for?
Is it
Cervical. Clavicle.
Cervical.
Clavicle.
Cervical.
Cervical.
Clavicle's collarbone. Cervical is your neck. How many cervical vertebrae do you have?
Yeah.
5?
7.
7. You got 7 cervical vertebrae. So what this thing is saying is between, between 5 and 6 are nerves that come out that connect to this muscle. And so if I had a pinched nerve in my neck at C5 and C6, I actually might have problems with my deltoid. This is actually, it's not important you memorize this because I already told you to all the muscles, all the nerves that come out of the neck feed the arms. And you're going to rub the whole neck. You don't need to remember C5 and C6. You do need to remember that the nerves that come out of your neck tend to feed the arms. But this is important because if I come to you and say, I've got numbness or pain here, I might actually have a problem here. I really might. But I also might have a problem here. So don't just rub the place where the pain is. If I call you right now on your cell phone and I say fire, I might be telling you about a fire at your house, but I might be telling you about a fire at my house. Just because you have pain down here actually does not mean necessarily that you actually have a problem here. You might have a wiring problem. A pinched nerve up here can make your brain think there's pain here. But it also doesn't mean that the problem is always here. I'm just saying you would always work on this area and the place where the nerve came from. So anytime somebody's got arm problems, I always work their neck. I also work their arms. And you might say, well, Tapscott, how do you know if it's one or the other? And actually, at our level of understanding, it's very hard to be right for sure. But does it hurt anybody to rub both their arm and their neck? No. So at least I know some things to work on to guess at. That's the idea. So you don't need to memorize the ends, nervation. I just want to explain to you what that meant there. It meant the wires that come out of the spine that tell the deltoid what to do come from between vertebrae C5 and C6. That's where they come from. And that's what feeds the deltoid. And it does mean if I somehow put a nerve blocker right there, you wouldn't be able to lift your deltoid. It wouldn't work. But from a massage therapist point of view, I just need you to realize that the arms, that the nerves that feed the arms, that move the arms, come from the neck. That's it. That's why we don't teach you nervation. It's not really that important. It's super important, but it's not important you know it down to the finite detail. If you were a neurosurgeon and you're trying to find the exact nerve that's a problem with somebody, it's super important. But then you do all this fancy testing to figure that out. Okay? All right. Let's take a little break because I actually want that to all absorb into your heads because this is really important stuff. But all we're going to be talking about when we talk about muscles like this, I shouldn't say all, but a lot we're going to be talking about is origin and insertion and the actions that follow. Yeah? Take 5. Take 5, everybody. Mr. Kandaris, are you there, by the way?
Yes.
Okay. You weren't there a minute ago. That's why I was asking. Cool.
Sorry.
All right. Take 5, everybody. Okay, they're muted. Sorry, I'm probably not supposed to be in here with you without it on at all. Okay, it's hard to talk.
Oh yeah, and it's hard to understand too. So
They're
cool.
already having a hard time. So, anyway.
This is the captions. Remember how I was telling you?
Oh yeah.
But you can't see it, but I did screenshot.
And do you see how when you scroll up, all of a sudden their names appear?
Yes.
And if you don't ever see one, you can just kind of scroll over their thing. And yeah, I find it so helpful. Like I know all their names, but occasionally I just brain fart,
Right?
and I'm like, I love that.
That is cool. So you can see. I'm just trying to see if you could change like the language, but it's not that cool. But that's what it looks like when you're talking. But for some reason, Diamond, her name always it comes up Diamond Skip. I don't only heard it both times. It doesn't go.
Diamond Skip.
It says her name, Diamond Hunter, and then Skip, and then it lets you keep talking. So I don't know if somehow it doesn't matter.
I don't know. I just don't understand.
My only suggestion
Yes, talking.
is your name for some reason like stays. It seems like more often than everybody else's. You know how you said to move it. So you gotta step back like another foot because I don't think all of them are.
The name is covering me up too.
Yeah, I don't think a lot of them are pinning it because like
Yes.
remember how she was like, I can't really see what you're saying. So maybe a little foot back so that you're above.
Well, the other thing I thought about doing is I'm showing the slide presentation on the screen.
Yeah.
I can actually show it. I can have them pin me. So because right now what they're trying to do is they're doing what you're doing. But I can actually have it so I just have,
You.
yeah, they just pin me, and the slide production is actually on the screen, and I am standing there like a true lecturer.
Oh. You should test that out because then
Yeah.
they could still read it.
Should we test it right now since you're here?
Yeah.
Yeah, let's try it.
How are you gonna get that? Let's see.
I don't know. That might be part of the problem is how do I,
You'd have to have it going from this computer to there, right? Is that what
yeah,
talks to
hold on.
this?
Let's see here. We're going to turn the projector on.
I mean, and I don't know if it's good or bad. It might encourage them to have their book in front of them also if they can't as easily see it on the screen.
Yeah, which might be good too, I don't know. But I've now forgotten how to turn on the projector. You've selected computer, okay.
Mr. Tapscott?
Hold on, gotta.
Mr. Tapscott?
Yes, I can hear you.
Okay, I have a question.
Yeah,
So if I'm extending my arm,
uh-huh.
and obviously I'm elongating my scapula, but am I elongating my deltoid or am I shortening it?
You are shortening the deltoid, if that's what you mean, in front.
Okay,
And you are elongating the posterior deltoid right now.
okay.
And all sorts of stuff is happening with your scapula, but I hesitate to get into that yet.
Right, okay, that makes sense.
But I'm actually glad you asked that question. I want you to ask it again when we get back in class because that's the next thing we need to think about.
Okay.
Hold on, we're just trying a little trick out here. Let's see. I don't remember how to do this. I don't understand why we don't have projector right now. Oh, here we go. I finally got settings. I had to push it a couple times. Projector on. But I'm worried it's going to show all of them too, and I don't know if that's good or, well, it doesn't matter. We'll find out. So, interesting. Okay. It's only recording that. That's good. I still have to see them, so I can't make this bigger. That's the problem, is I can't make it the full screen size because I have to see them.
True, and with the angle, at least now,
It's
I
terrible.
can't read it.
Hey, Miss Petrie. Can you see what's on the screen right now?
Yeah, I mean, blurry, but yes, I can see it.
But it's blurry, right?
Yeah, it's very blurry.
Okay. I think that kind of answered that question. Even if I blew it up, the angle, and we could change angle, by the way. I can put one of these cameras out there. But I'm just worried, but I have to be able to see them.
Right.
Otherwise, I lose the interaction kind of thing.
Yeah, that would suck.
Yeah, I love, yeah. This helps me, too, to be able to see their wonderful faces. Like, oh, people, okay.
Right, okay. So
Do
we turn
you,
that up.
by the way, do you want to get out of here? Do you want to stay? I'm fine with either one. Because we can always do this, you know what I mean?
Yes, I have a thought. I don't know if we're on. Like when you have Jackie come in, I know you already have it scheduled. But if it was after, what time are you done teaching?
11.
So if you had her come in at 11:30, you could have done all this after, where you didn't feel like pressured and
Oh, true. Although I
started
kinda
up,
like-
but then you wouldn't have the students on.
Right,
But
yeah.
I don't know.
I don't know. I feel like I almost have to do both.
That's true.
I also have to show you guys a breakdown thing, like how would you actually do attendance?
Right.
How would you
That
turn it in?
Yeah.
Yes.
I am gonna go.
Okay. All right. High five, hug.
I know, it's so
Love
weird.
you.
Let's
I
go.
know.
I don't even get my hug.
Log out or leave me a way to log you out.
I'll log out. I'm still on in that one. Which
Okay.
that is beautiful over there too. You got one over there.
Yeah, it's gorgeous. All right, thank you for coming in.
No
Hey,
problem.
will you give me the instructions back so I can update them?
Please.
Yeah, because I'm going to update them again. Every time I'm going to kind of update them and add to them. And when they're perfect, we'll email you some.
Perfect.
Thank you. Thank you for coming in.
No problem.
All right, I'll see you later, alligator.
I'm gonna log off of this one. Do you want me to clean it down or anything?
No, don't worry about it. Okay, everybody. Just make sure everybody's back from their lovely break. Yeah. Cool. Thank you, guys. Cool. Miss Cooper, you're there? All right, good. Miss Felix Osuna, you're there?
Yes, I'm here.
Cool, thank you. All right, everybody. Okay, so Miss Petrie asked a really good question, and it's something we really need to think about. And it may help you to pin me to your screen so I'm bigger right now. But this is kind of stuff we have to think about. So, if the anterior fibers, which just means the fibers in front, contract, they shorten. They shorten. Contract means to shorten. They come together. They come together and that creates a flexion, right? So if they're coming together and creating a flexion, the posterior fibers are actually lengthening. They're actually being pulled open. Does that make sense? If the anterior fibers are shortening, the posterior fibers are lengthening. Right? I just saw a big O. Thank you. That's important because if I want to stretch the posterior fibers, I do the opposite of their action. So posterior fibers do an extension, I make it do a flexion, and that actually stretches the fibers. Anytime you want to stretch any muscle in the body 100% of the time, 7 days a week, 365 days a year, 24 hours a day, you do the opposite of that muscle's action to stretch it. And it makes a lot of sense if you think about it, because action means shortening. It's the exact opposite. My bicep works because there's an attachment here and an attachment here. There's actually a couple, but anyway. When they come together, when they shorten, I do a flexion. In fact, the reason my muscle balls up is literally muscle fibers are kind of like running over each other. That's where the balling's coming from, right? If I want to stretch this bicep, I do the opposite of its action. Its action is to flex. I extend, and the bicep stretches out. That's true all the time. And so you will have like tricky questions on your test and stuff. They're like, which muscle is stretching if this other one's doing this thing? And those questions, I hope they work, but they're intended to get you to start to think this way. Again, I don't want you to memorize actions. I want you to think about actions. Cool? All right. Okay. Whew. Yes. Okay. Miss Teres, what are the origins of the deltoid? There are 3 origins of the deltoid. What are the origins of the deltoid?
1/3 of the clavicle, the acromion, and the spine of the scapula.
That is 100% correct. Thank you very much. Miss Petrie, what is the insertion of the deltoid? There's only one.
Deltoid tuberosity.
Yes. That's where the shape of the deltoid comes from, if you think about it, right? It kind of hooks to the 1/3 of the clavicle, the acromion process, and the spine of the scapula, but it all comes down to this one point, and that's a deltoid. That's how it works. Cool. Cool.
So I have a question real quick.
Yeah.
I don't, maybe this is not where we're at all, so, but if I am doing, I have to think of what movement I'm doing, I'm sorry.
Well, you're doing multiple movements. When you do this, you're doing multiple movements, but your shoulder is doing a flexion.
So if I'm doing a flexion, then my posterior is lengthening. My posterior deltoid is lengthening.
Yes.
But it's attached to the spine of my scapula. So wouldn't my scapula be doing a movement as well?
Well, it could be. So it could drag the scapula along if something's not holding the scapula back.
Does that not matter?
It does matter.
It
does matter,
Okay.
yeah. I just don't know how to answer the question because the answer is yes. I mean, it totally affects the scapula. And we're kind of heading in that direction. So remember, the scapula is kind of a floating joint. And so we're about to learn about a muscle that helps hold the scapula in place so that your scapula doesn't come flying off your body. Because you do have to kind of anchor the scapula down. So the scapula might be an anchor for the arm here, but something has to anchor the scapula to the body. And we're about to find out about a muscle that does that. There's many muscles to do it, but we're about to find out about one that does that.
I guess my question is though, is that would that also be so if the posterior deltoid is lengthening, would that also mean that the scapula is lengthening as well?
No,
Like
no, it could.
But it would be shortening.
But, well, think about it this way. It depends on how nitpicky you want to get. But this is a left shoulder here.
Yeah.
This is a flexion, which is what you're talking about. The muscles in back are lengthening. The scapula doesn't have to move anywhere to do this. Now, in the real world, do we often move our scapulas when we're flexing? We usually do. But I can flex without my scapula going anywhere. I can do this. This is what you're doing. But none of us ever do this. Most of us actually protract the scapula when we're doing this. So we're not only stretching out the rear fibers here, we're stretching out stuff that holds the scapula in too. But we're getting a little ahead of ourselves. But you're right, the scapula can move. It's why, by the way, if my scapula couldn't move, this is as far as I can reach. But if I let my scapula move, it actually gives me about 6 more inches. This is scapular protraction and retraction. This is just flexion and extension coming from the deltoid and the glenohumeral joint here. So the scapula is a fascinating thing, by the way, everybody, because it's the base of movement for this thing. But what's so cool about your body is the base itself can move. So your glenohumeral joint, your shoulder, can do all this cool stuff. But then if that's not cool enough, it can take the scapula with it and do even more stuff. Right? My middle fibers of my deltoid.
I have a question.
Yes, please, Miss Monreal.
I didn't mean to interrupt.
No, don't. Please answer.
What do you call it when you just reach straight up?
Well, what do you mean by, can you show me reaching straight up? Like, are you reaching straight up from the side?
Like if you were gonna for something up.
Yeah. It's like in front of you though, like this?
So would you name the side movement then?
Well, I'm not sure.
I'm thinking right in front of you.
Okay.
So if you're just like reaching straight up, what would that be called?
Well, you're moving 2 joints to do this. One joint is my shoulder joint. What's my shoulder joint doing?
Flexion?
Yes,
Oh.
yes, this is a flexion. Now,
Okay.
while I'm doing that, I'm doing something with my elbow. What's this?
Extension?
Yes. So what you described was, and this is the way we move, right? We don't usually move one joint, but when we're learning right now, we're learning one joint at a time. But this is me flexing my shoulder, extending my elbow. Flexing my shoulder, extending my elbow. Yeah. Does that answer your question now? That's a yes, I hope. Now, the deltoid doesn't extend my elbow, right? There's other muscles that extend my elbow. It's actually your tricep back here that extends your elbow as you flex your shoulder. But this is mainly, I am oversimplifying again, but mainly the anterior fibers of my deltoid are flexing it, and the triceps brachii and back is extending my elbow while I do this. These are your main punching muscles, by the way. Your chest is too, but that's different. Okay. Cool. Questions? Thoughts? All right, let's move along and try to apply this to a different muscle now. And again, we're trying to take this slowly so we can really digest this and really think about muscles in a whole new way. Whole new exciting way, if you ask me. Any questions so far, though? There's a beautiful picture here of how easy it is to palpate, which just means to massage, to feel, the deltoid. The deltoid is a superficial muscle. It's on top. I'm touching it right now. It's very easy to grab. Today in lab, make sure that you grab your partner's deltoid. Move their arm around. You should be able to outline the shape of it very clearly. Very clearly. And thank you for those of you that are touching your deltoids. It's fantastic. All right. Next muscle, and this muscle works with the deltoid. They don't do the same things, but they often work together. And they share something really interesting in common. This is a picture of only half the muscle. The whole muscle looks like a diamond on the back. It looks like a big diamond. Like the deltoid, it's got 3 sets of fibers that all run different directions. So it essentially runs from the back of your head out to your shoulders and down to T12, which is the last vertebra that has a rib attached to it. So right down about here. That's a big muscle. We only think of our traps as being up here, but they're actually this whole area. So they have 3 distinct sections. They have upper fibers, middle fibers, and lower fibers. Upper fibers, lower fibers, and middle fibers. Yeah? Yeah. Good. I'm getting some very positive nods, and so I'm going to ask you some questions, Miss Hanson. And not to discourage you from nodding. Thank you. Miss Hanson, don't worry about the origins or all that, but if I have these upper fibers, and they contract, they come together, what might happen? And I don't care what language you use to explain this. We're just trying to fumble our way through this right now. If these fibers from here to here contract, what do you suppose might happen?
Are they
Yeah.
extending?
You used the wrong word, but you did the right action. They are elevating my shoulders.
Elevation.
Yeah. And I was fine with that. I just wanted you to be like, the shoulders come up. Yeah. And you could tell that, right? You didn't have to memorize the action. You were just like, oh, yeah. By the way, Miss Hanson, what might happen if my shoulders were being held down by something else and those muscles contracted?
Depression.
But the shoulders are being held down. They're not going to go anywhere. But they're attached to my head. What might happen if the shoulders don't move and these muscles shorten?
Oh, extension.
Yeah, extension of the neck. So it's not the main purpose of this muscle, but if I am pulling, if this point is pulling this point and it stays here, it can go like this. But if something's not holding this and there's pulling occurring, it can go this way. So the main job of my upper traps is to kind of lift up my shoulders and elevation of the shoulders. But if something else were locking down my shoulders, I have other muscles that will hold my shoulders down, then my head will have all this pressure on it and it will pull it back. Because it's got two sides to it pulling it back. Yeah. By the way, that's if it's working bilaterally. What does bi mean?
Two.
Two. And bilaterally means both sides working. If it's working unilaterally, it'll pull my head to the side. If just one side's working unilaterally, it'll pull my head to the side. That's upper fibers. Cool. Thank you. Ms. Yanez. The traps also have these middle fibers that kind of run from here towards the middle of the back. If these contract and come together, what's going to happen to the scapula? If these contract and come together, the middle fibers, what's going to happen to the scapula?
Is that retraction?
It is retraction. Thank you very much. It's retraction, and by the way, that's 100% correct. And the other word for retraction, when the scapula comes together and gets closer to the spine, when it gets added back to the spine? Yes, adduction. Thank you. The middle fibers, the trapezius, can retract my scapula and adduct my scapula. It's the same thing. Pulling it back in. It's behind there pulling, right?
I have a question about that. Is that also lateral rotation then?
No. Here's why. It's grabbing the scapula. It's not grabbing, scapula can't really rotate in the way you're describing. It's not grabbing the shoulder, not grabbing the joint, right? So rotation happens here, right? In this ball and socket. But the trapezius doesn't grab onto this. The deltoid does. So the deltoid can move your arm around, right? The trapezius grabs onto the scapula and it'll pull it back and forth, but they don't consider that rotation. They consider retraction or adduction. Yep. So your thinking's basically right. But anyway, if the trapezius doesn't grab onto something that can rotate, so to speak. By the way, not to make it even more confusing, but scapulas can rotate, but not the way you're talking about. They rotate this way. And they do it when I'm lifting my arm up like this. It can only go up this high because this humerus heterochromium process. This is as high as you can lift your arm at your glenohumeral joint. So how is Miss Cooper able to do this? This is as high as her glenohumeral joint will allow her to go, and yet somehow Miss Cooper just did this. How did she do that? She cheated. She stopped using her glenohumeral joint and she rotated her scapula. So the deltoid gets you up to here, and this thing runs into bone and stops. And then your scapula rotates up to actually get you the rest of the way.
So would that make it, I don't know, but would that, if the scapula is rotating, would that make it a superior rotation and inferior rotation then?
Yeah, that's exactly how we talk about it. What we do is we pick the acromion process. We call this the top. If it moves up, we call that a superior rotation. If it moves down, we call that an inferior rotation. And we have to pick this point because when this is moving down, the bottom's moving up. And so if you don't decide on a point to pick, you don't know how to talk about it. But we talk about it from here. So, and luckily when my arm's moving up, this thing's going up too. But this is a superior rotation, inferior rotation. What does it look like?
What does that look like when it's moving down then? Like what type of movement is that?
Well, it'd be involved in an adduction of the whole arm.
Oh.
But we just call this a downward rotation of the scapula. So if my arm's way up here, I've actually, to get my arm up that high, I've not only maxed this joint out, but I brought this one up. And so to get it back down, I have to adduct the humerus, and downward rotate the scapula to get my arm back down here. So it's a downward rotation of the
So
scapula.
it's not a different movement, it's just the opposite.
It's just opposite, yeah. It's always opposite to get back where you started, always. So, Miss Nguyen. Miss Nguyen, we talked about upper
Yes.
fibers, middle fibers. We've got lower fibers here. If these fibers down here, this part of the muscle, the lower part of the trapezius, if they pull together, if fibers pull on this scapula, what's it going to cause it to do from the bottom? If the bottom fibers, the lower fibers pull down, what's it going to cause it to do?
Adduction.
Pretty close, actually. There would be a little adduction, by the way, because it's pulling in. But also, we just call it when you're not elevated. What's the opposite of elevated? I'm very depressed right now.
Evolution.
Depression.
Yeah.
Elevation, depression. So we're going to depress them. They're going to pull them down. You use these fibers all the time. I know you're probably thinking, well, I don't pull my shoulders down all the time. Yes, you do. You pull them down all the time because when you're doing certain things, you need to pull them down to kind of lock your shoulder blade in place. So we use our lower fibers a lot to help control our shoulder blade, to lock it in place so I can do stuff with my arm. Because you actually don't want your shoulder blade flying around when you're doing stuff with your arm. It sounds really weird, but when I write or type, my shoulder blades have to lock down so that they don't wiggle around when I'm trying to write. They've got to lock down on my back so I can control my hand and arm. We use our lower lats a lot. What?
Adduction and retraction.
The adduction and retraction would be more from the middle fibers, pulling in.
Oh.
The lower ones pull down because they are down. And that's the depression. Down.
Down.
Yeah. Cool. Let's take. Woo! Okay, here's a side view. Miss Hunter. Hopefully you can see the slide I'm on right now. If not, we are on page 69 of your trail guide book. What is the insertions, there's 3 of them, for the trapezius? What are the 3 insertions for the trapezius? So just read next to the eye.
So this slide is where it says trapezius, and you're showing the skeleton from the side, correct?
Yes, and we're looking at the letter I.
Okay. And the question was, what's the insertion of?
Yeah, there's 3 of them. What are the insertions?
Of the delta?
Of the trapezius.
Oh, of the trapezius? 1/3. The insertion of the trapezius.
Yeah, just read next to the eye.
Is it the? Oh, okay. The entire sentence.
Yep.
Lateral 1/3 of clavicle. Acromion and spine of the scapula.
Thank you so much. What is interesting about what what is interesting about what Miss Hunter just told us?
Isn't that the same as what we just went over on the Latissimus dorsi?
Deltoid?
Deltoid, sorry.
Don't be sorry. Yeah. The insertion, where the trapezius inserts, is where the deltoid originates. They 100% share an attachment. So on a human body, when you come rolling down this trapezius, you roll right into the deltoid. So the trapezius inserts into the lateral 1/3 of the clavicle, the acromion process, and the spinal scapula. The deltoid starts. So the trapezius finishes here, the deltoid starts here. Which is very helpful because the trapezius is one of the things that helps to lift up my scapula, and my deltoid is one of the things that helps to lift up my arm. So this action kind of uses both of them together. This is where we start combining actions. But don't worry about that yet, but it's very cool. They share an attachment. perfectly. That's not by accident. Trust me. Now, the trapezius originates from someplace completely differently. And it looks really confusing in your book. So, Mr. Kondaris, will you read the origins of the trapezius, sir?
External occipital protuberance, medial portion of the superior nuchal line of the occiput, ligamentum nuchae,
Good
and
job.
spinous processes of C7 through T12.
Thank you. What the heck did he just say? Like, I hope you're confused, because this is some of the most confusing stuff you'll ever hear while you're in here. Let me first tell you what he said just in like layman's terms, just ordinary stuff, just so we understand. The trapezius hooks to the back of your head and down your spine until it gets to the end of your ribs. That's it. The trapezius hooks to the back of your head and goes down your spine on these bumpy things till it gets to the last, till it gets to T12, which is your last vertebrae with a rib on it. So it just really said, he said in really fancy medical terminology that I'm going to explain to you here in a second, he said the trapezius hooks to the back of your head and goes down to here and hooks all these bumps all the way down. That's it. And it comes off here. This is the origin, the part that doesn't move. It comes off here and inserts into the lateral 1/3 of the clavicle, acromion process, spine, and scapula. But it starts here from the center of your spine, between your head and T12. What does T stand for?
Thoracic.
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 Yep. Yep. What is true about every single thoracic vertebrae?
A rib is attached to it?
Got a rib attached to it. How many thoracic vertebrae are there?
12.
12. So this muscle goes from the last rib all the way up to your head. And it attaches to the spinous processes, the things that stick out from your spine. All right, so I'm going to break this down because it's very confusing the way they talk about it. I need some props, so bear with me. Okay. The back of your head, back here, touch the back of your head. You are touching your occipital region. Occipital region, it's extremely important. A lot of really important muscles attach back here, and you will care about this spot a lot. We will be massaging a lot. See if you can find a small bump back there. There is a small bump back there. On some people, it's really easy to find. It's actually kind of big on some people, and other people, it's small. But there's a kind of a bump back there somewhere that sticks out. It should be in the center. Kind of feel it, kind of at the base of your skull, you'll feel a little bump. You might even feel a couple of bumps on the side of that bump on both sides. You might. Just depends on how bumpy the back of your head is. That bump protrudes from your head. It is a protuberance, which is the same thing as a tubercle. Same thing as all these words they give for bumps. There's a bump inside your skull that you can't feel right now. Don't try to find this because you'll kill yourself. Don't lift off the top of your skull and reach in. But there is a bump inside that's an occipital protuberance too. This is the internal occipital protuberance. This bump on the outside is called the external occipital protuberance. The outside bump in your occipital region. That's what that means. External occipital protuberance. You will need to know that for the rest of your life. Like, it's used a lot in massage. We talk about it a lot. It's a very important bump. Lots of important stuff attaches to it. It has a lot to do with how I can hold my head up. But it is the external bump in the occipital region. It is called the external occipital protuberance. And that is where the traps start from. Now, on both sides of this occipital protuberance, and you won't be able to see it in the slideshow, you might be able to feel it on your head, but there are lines coming out from both sides that muscles attach to too. And there's lines that are up high and there's lines just a little bit lower than them. And the ones up high are called the superior nuchal lines. And they run out to the side of your head and all sorts of important muscles attached to them. Superior nuchal lines. There are inferior nuchal lines that are almost impossible to find. But these lines, the superior ones, run out from both sides of the occipital protuberance. They are lines, bumps on the bone too, that muscles like to attach to. And this thing is saying that this muscle grabs onto the external occipital protuberance and the medial portion, the middle portion of the superior nuchal lines. Pretty damn confusing. So, let's just make sure. This is the back of a head. There is a bump back here. This bump is a protuberance. It's protruding, sticking out. It's external. It's on the outside of your head. It's not the one that's on the inside where your brain hooks to. It's your external. It's in the occipital region. This region of your back of your head is called the occipital region, or the occiput. This is the external occipital protuberance, that bump. You've also got little lines, like a ledge of a cliff back here, very tiny, that muscles like to attach to. This muscle, your trapezius, attaches to the middle portion of it. Doesn't grab all the way out here. Other muscles we're going to learn about later grab onto there. So this trapezius grabs onto this external occipital protuberance and the middle portion of the superior nuchal line, because there's also an inferior nuchal line that it doesn't grab onto, that other muscles grab onto. So unfortunately, super big words to say it grabs onto the back of your head. The middle of the back of your head. That's what they're saying. Yeah? And just a little insight about Tapscott. Tapscott likes to ask lots of review questions about origins, insertions, and actions. That's about all Tapscott seems to care about. He's kind of bent in that direction. And so it's very likely that Tapscott tomorrow, and the day after tomorrow, and the day after tomorrow, and the next week, and the next month, and the next couple of months, will be asking you things like, hey, what's the origin of the trapezius? What's the insertion of the trapezius? Can you point to that on your body? What action would that form? Don't overwhelm yourself, by the way. I'm doing that to drill you, but I just want to let you know, if you had to study anything, origins and insertions. If you learn nothing else from this course except the origins, insertions, these 100 muscles, you'd be one of the best informed massage therapists in Arizona. Because most therapists don't know. And those of you who've been therapists before know that's right. Thank you. And if you do know them, you sound brilliant. Your massage is great because you know exactly where to find things. You can figure out all sorts of structural problems with the body. You can do all sorts of stuff. So, super important. But anyway, external... Oh, go ahead.
Back to... That's part of the reason I personally came back too, is because I didn't know.
Yes, thank you.
My anatomy, really, I couldn't remember any of it.
Yeah. And by the way, she's not unusual. She's typical. Yeah. Most schools don't teach it that well and all sorts of stuff. But anyway, so Ms. Petrie said, I want to come back to school and actually learn the portion that's actually the most important. So we've got this trapezius muscle that attaches to the external occipital protuberance, the bump on the back of your head in the occipital region, the middle part of the superior nuchal line, and then it attaches to this thing called the ligamentum nuchae. Ligamentum nuchae is fascinating, by the way. The ligamentum nuchae is a ligament. Ligamentum, right? It's a ligament in Harry Potter times, right? Ligamentum, but it's a ligament. What do ligaments do? Who can tell me what ligaments do? They attach what to what?
Is it muscle bone?
What? Wait, what? Do you guys need me?
Bone to bone.
Bone to bone! Ligaments attach bone to bone. They're like tough little ropes that attach bone to bone. Yeah. That's funny? No? They attach bone to bone. The ligamentum nuchae essentially attaches the back of your head to C7. That bump that you find in the back of your back, remember I called it vertebra prominence? Yes, tendons attach muscle to bone. I'm sorry. Oh, God. Yes, tendons attach muscle to bone. Ligaments attach bone to bone. They're really the same thing. It's like calling two different ropes a different name depending on what you use them for. But tendons attach muscle to bone. Ligaments attach bone to bone. Gotta make sure I'm not saying it wrong. So, is your head a bone? Your skull? Yes. Is C7 a vertebrae bone? Yes. The ligamentum nuchae is a super important ligament that attaches your head to C7. But by the way, it also connects to C2, C3, C4, C5, C6, all the way down. It's kind of like this, kind of like a big ribbon back here. Most mammals have this ligament. Part of the ligament's job is to hold my head up. Your head weighs 8 to 10 pounds. This is an 8-pound dumbbell. It's extremely easy to hold up like this. Put it out there like this, and it gets really, really hard to hold. Might be able to do it for a while, I don't know, but an 8-hour day hunched over a computer, part of what your ligamentum nuchae does is hold on to this head. You ever seen horses running? Horses have big heads, and they're way out over here, and they're galloping along. Horses have a huge ligamentum nuchae. A horse's ligamentum nuchae is so big and so thick that if a horse lets its head go, it does not fall down. A horse has to pull its head down to drink water. It has to fight against its ligamentum nuchae. It needs a big ligamentum nuchae to hold its head up when it's running. So, the trapezius likes to attach to the external occipital protuberance, the middle portion of the superior nuchal line, and the ligamentum nuchae. It runs all the way down to C7. Ligamentum nuchae is just attached right down here, and it gives support to your head and spine. And then it attaches to the spinous processes of C7 to T12. What is a spinous process, Tapscott? Well, this is a cross-section of a vertebrae. Probably lumbar vertebrae because they're really big. But anyway, if you were looking straight at somebody's back, in fact, when you're rubbing somebody, do you ever rub across some bumps right in the middle of their back? Well, you're not supposed to, by the way, don't do it a lot. but the bumps right in the middle of their back, they're like little dragon spikes that everybody has. Those are spinous processes. Processes, right? Little bumps kind of like sticking out of the spine. By the way, these ones going out to the side are called transverse processes. But anyway, these are spinous processes. So they stick straight out the back, and the trapezius attaches to both sides of them. So it's really confusing what they said, because the ligamentum nuchae attaches to these spinous processes too. They really could have said this many different ways. They could have said the trapezius hooks to the back of your head and all the spinous processes down to T12. That would have been a nicer way to say it, but they got very nitpicky. So they said, hey, it sticks to the bump on the back of your head, but we're not going to call it that because we want to make sure that people have to go to massage school and learn this stuff. We're going to call that the external occipital protuberance. And then it hooks to this, kind of goes across the skull a little bit, across this line here that's superior to another line. So we're going to call that the superior nuchal line, but it's only the middle portion. So the middle portion of the medial portion of the superior nuchal line. And then it grabs on this ligament that comes down here that runs down to C7, so that's the ligamentum nuchae. And then it attaches to the rest of the spinous processes, things sticking out of the back, all the way down to T12. So confusing, but so simple at the same time. So sometimes it helps just to kind of think. If you're looking at the back of somebody's body, there's their head, there's their scapulas, Here's their spine. These are little ribs coming out. There's not the right number, I don't care. The trapezius hooks onto here and here. It goes out to the clavicle, out to the acromion process, out to the spine scapula. Out to the clavicle, out to the acromion process, out to the spine scapula. And because the trapezius inserts where the deltoid originates, off this same spots come the deltoid. And I'm a horrible artist, but it's shocking how realistic this is because of knowing origins and insertions. Oh, that's very nice. You guys get an A for the day. You did not see ligamentum nuchae, I'm sorry, ma'am, but it's under here. It's right there. Ligamentum nuchae runs from your occipital protuberance down to C7, which is right about here. Does that make sense, Miss Hunter? Yes, make sure you have your trail guides on if you're having a hard time following along. We're on 69. So, second little thing to kind of remember about muscles. Make sure you don't miss this part. Okay, Miss Hanson. So the second thing to remember about muscles is I can't pull what I'm not attached to. I can't pull what I'm not attached to. Let me explain what that means. Does the trapezius insert or attach to the humerus? Does the trapezius insert or attach to the humerus?
No.
No. Can the trapezius move the humerus?
Yes.
No.
No. Oh, no, sorry.
It can take it along for a ride, but it can't move it. Now, I understand that the trapezius inserts into the scapula, and it can move the scapula, and I admit when my scapula moves, it kind of drags my humerus with it, but it can't move my humerus, right? Does the deltoid attach to the humerus?
Yes.
Yes. Can the deltoid move the humerus?
Yes.
Yes.
Can the deltoid move the scapula?
Yes.
By the way, you could argue that. Don't get me wrong.
Yeah,
But basically no. Because it's got to be anchored to the body to pull it to the body, right? And it's not. Does that make sense? The trapezius...
So even though it's attached to
What?
the spine of the scapula, the deltoid is attached to the spine of the scapula, though.
Yes, it is. It's attached to the spine of the scapula. But when you move the scapula around, you move it in relationship to the body, not to the arm, right? And it's not attached to the body. Like, the deltoid is not responsible for holding your scapula onto your body. Your trapezius is. So I'm not trying to trick you guys up. I just want you to kind of remember I can't pull what I'm not really attached to. So the trapezius is responsible for moving my scapula around my body. Other muscles are too. But it moves it up. It can retract it. It can depress it. So elevate, depress, retract, or adduct. The deltoid is responsible for moving the arm, abduct, flexion, extension, medially rotate, laterally rotate. Now, do I often do those actions together? Do I often do those actions together? Yes. It is quite common for me to elevate my scapula while abducting my arm. And then I'm using the traps and the deltoids together. If this is feeling like right now, don't worry. We just keep ramping stuff up and we're adding stuff. Yeah. Okay, so I'm going to ask some questions of you, and all I want you to do is tell me which muscle is doing this action. And you only have two choices, trapezius or deltoid. Two choices. So I'm going to do an action. I'll tell you what it's called even, and you just tell me, is it the trapezius or the deltoid that's basically doing that? Yeah? Miss Hunter, I am elevating my scapulas. Which muscle is responsible for that?
Your voice rose, but I saw you do this, and so that's the trapezius.
That is the trapezius. Hey, for an extra $100, which fibers are the trapezius? Upper, middle, or lower?
Fibers that are making this part?
Yeah, making this part. Upper, middle.
Is it, hold on, I need to look at the slide.
Upper, middle, or lower?
Oh, gosh. I'm sorry, what was that?
Is it the upper, middle, or lower fibers?
I'm gonna assume the upper.
Yes, you're going to assume the upper because I'm going up. I can't pull something up unless I'm up. Perfect. Thank you. You're absolutely right. The upper trapezius fibers elevate the trapezius. Thank you so much. Miss Torres. Miss Torres, I'm elevated right now. Is it the deltoids or the trapezius that will depress my scapula? Pull it down.
The trapezius.
The trapezius. Which fibers, by the way, pull it down? The upper, middle, or lower?
Lower.
Yeah, because I'm pulling down. Right? Cool? Awesome. Thank you. Miss Nguyen. I am abducting my glenohumeral joint. In fact, that's as far as I can go. I'm abducting my glenohumeral joint. Is that the trapezius or the deltoid? Which muscle? Trapezius or deltoid?
You added the what in the muscle, right?
Yes, which muscle? Trapezius or deltoid? Which one does this? Abducts my glenohumeral joint. By the way, if it's moving the arm, it's got to be attached to the arm. It's got to insert in the arm.
Not in the deltoid, right?
It's not in the deltoid? Which one is it, deltoid or trapezius? Take a guess. Which muscle attaches to this arm? Which muscle attaches to this arm?
Deltoid, right?
Deltoid. So if the deltoid pulls, it's going to move this arm. So the answer is the deltoid. The deltoid lets me do this. Yeah?
Deltoid, yeah.
Cool. All right. Miss Yanis, which muscle allows me to do a medial rotation of my glenohumeral joint or my arm?
The deltoid.
The deltoid. Which section? Which fibers? Which fibers allow me to kind of roll?
Isn't it all of them?
Nope. Abduction might be all of them, but if I'm medially rotating, I'm kind of rolling my shoulders forward.
Anterior.
Anterior. Thank you. Thank you. Thank you.
So I action about that.
Yeah.
Aren't you moving your scapulas when you do that too?
I am, because I'm having a hard time isolating. I can just medially rotate, but I don't even know if you'd see it. But I'm doing it right now, and I can keep my scapula still. But you're absolutely right. Usually when we medially rotate, we protract too, or abduct our scapula. So usually what really happens is as we medially rotate, our scapula comes forward too and kind of collapses in. Yeah. But we haven't learned about a muscle yet that protracts your scapula, only one that retracts your scapula. Yeah. Cool? Let's see. Miss Hanson, Miss Hanson, what muscle allows me to do a flexion of the glenohumeral joint?
The deltoid.
The deltoid. Which portion of the deltoid?
The anterior.
Yeah. It's pulling in front. It's got to go in front. Thank you very much. Miss Stanley. Which muscle allows me to do an extension of my glenohumeral joint?
Deltoid posterior.
Yeah. Miss Stanley. Which muscle allows me to do a lateral rotation of my glenohumeral joint?
Is it still the deltoid?
Still the deltoid. Still posterior fibers. Thank you very much. Miss Felix Osuna.
Yes.
Trick question, so get ready. Which muscle allows me to abduct my glenohumeral joint and upwardly rotate my scapula? Because what's happening here is I'm doing this and this. So what muscle allows me to abduct my scapula, abduct my glenohumeral joint, my arm, and upwardly rotate my scapula? It's a trick question. Is it the deltoid or the trapezius?
The trapezius?
You are half right.
Is it the upper fibers?
No. Yeah, I mean, yes, but it's the trapezius and the deltoid. Because we're talking about moving the arm and the scapula. That's why I meant trick question, sorry.
No, muscles.
Yeah. So the deltoid is helping me do this action, this abduction, and the upper fibers, the trapezius, are helping this thing rotate up to get me the rest of the way up there. And thank you, Miss Hanson, for moving your arms while we're talking. It's really important. You've got to think about it. Because what happens is the deltoid did this. That only gets me out to here. Then the trapezius actually grabbed onto here in the back of my head and rotated this thing up. It helps with an upward rotation.
I have a question.
Please. What's your question?
So, you're up. You need the latissimus dorsi to get them down?
Yeah. Yeah.
Are you going to use the latissimus dorsi to get it down?
Yeah. I mean, by the way, gravity will get it down, right? In this case, gravity will get it down. But let's suppose I was swimming or something, and I got my arm up here and I'm swimming. Yes, my latissimus dorsi would pull them down. Yes. Yes. Cool? Okay. It's okay if this is confusing, but hopefully it's like confusing but making sense too. You know what I mean? Like a little bit of both? Yeah, maybe. I don't know. Okay. Okay. Let's see here. Mr. Kandaris.
Yeah.
I'm kind of getting aggressive with you, and I'm retracting my scapula. Kind of looks like I'm throwing my chest out, but I'm really retracting my scapula. What muscle is responsible for that? Delts or traps?
It seems like trapezius, but I'm gonna go with deltoids.
Why don't you go with the one it seems like?
Oh, okay. I don't see it on here.
Yeah. Well, yeah, it may not be on there. Like,
okay. Then yeah.
Oh, I see what you mean. You don't see it on there as one of the actions?
Yeah.
So he's 100% right. It's not on there as one of the actions. If you guys look at the actions for trapezius under middle fibers, why is retract not on there? Who can answer that question? They don't have retract on there, but they do have the answer on there. When I retract my scapula, what's happening to it?
Adduction.
Adduction. Thank you very much, Miss Hunter. Adducting the scapula is exactly the same as retracting it. When I pull my shoulder blades back, they are adducting back to the spine. So Mr. Kandaris is absolutely right. It didn't say retract on there, but retract and adduct the scapula are both the same thing. And people use them interchangeably. Because I'm adding my scapula closer to the spine when I retract. When I pull it back. Yeah? Yeah. Cool. Okay. Miss Harper. Miss Harper.
Yes, sir.
Which muscle, trapezius or deltoid, is responsible for this?
Trapezius?
Yes. Trapezius is hooked to my head. So it can't be the deltoid. It's the trapezius. It's the trapezius working one side only, which we call what? When I'm only working one side, it's not bilateral, it's
Unilateral?
yes, unilateral, like a unicycle. It's one side. Yep. Because if both sides are pulling, my head would actually go back. Because it's behind me. If both sides are pulling back here, like I had two ponytails, it pulled my head back. But if I only pull one ponytail, it pulls to the side. Other ponytail pulls to the other side. Yep. Very good. Okay. So that's deltoids and traps. Deltoids and traps share an attachment. Right? The insertion of the trapezius is the lateral 1/3 of the clavicle, acromion process, spinous scapula. The origin of the deltoid, where it starts, is the lateral 1/3 of the clavicle, acromion process, spinous scapula. One moves the arm, one moves the scapula. Deltoid moves the arm, trapezius moves the scapula. They tend to work together. This is the first time that you've been introduced to kinesiology, so don't feel bad if it's still soaking in. Trapezius is very palpatable. It is a superficial muscle, which means it's on the surface. If I peeled back the skin on your back, you would hate me, but afterwards we'd be able to see your trapezius right away. It's on the top. That's what superficial means. It's not a lower line muscle. When you grab somebody's back of their neck, one of the things you're grabbing is their trapezius. When you rub their upper back, one of the things you're rubbing is their trapezius. You can't avoid it. Let's talk about the latissimus dorsi. We are on page 71. We are rounding the corner. It's going a little slow today because we're trying to kind of put in your actions, right? Your flexions, extensions, abductions, medial rotations, all this kind of stuff, all these concepts today. But I think we're doing very well. Latissimus dorsi is arguably the largest muscle in the upper body. It essentially attaches to my butt and my spine down here and then reaches underneath my armpit and hooks into my arm. The back of your armpit is mostly latissimus dorsi. The front of your armpit, by the way, is mostly pectoralis major. Don't worry about that yet. But your armpit is made by muscles on both sides. There wouldn't be a pit there. There's muscles on both sides. Just like a valley is not a valley. A valley's there because there's two mountains. The valley's created by the mountains. Your armpit is created by a big latissimus dorsi making up the backside of your armpit. When I grab the backside of my armpit, I'm grabbing my latissimus dorsi. I'm grabbing other stuff too. You're grabbing teres minor and major and all sorts of stuff, but you're grabbing latissimus dorsi. So, this muscle reaches underneath my arm and inserts in to a groove between the greater and lesser tubercles. It inserts into the intertrabecular groove. It actually comes up my back, reaches under here, and inserts into this little groove here, deeply inserts into there, and holds on for dear life between the two tubercles. This is the intertrabecular groove. So when the arm's way up here, and this muscle pulls, what's going to happen? What do you say, Miss Hanson? I just saw your lips move, that's all.
Are you pinching it?
Well, yes, you are. That's true. But what action is this when I pull the arm back down?
Adduct.
Yes, adduct. And if it's in front, it's still going to do the same thing. It's still going to pull it back down. What action is that?
Extension.
Yes. This muscle is a powerful extender, a powerful adductor of the humerus, which is just to say it's really good at pulling your arm back towards your body. Why is it the largest muscle in the upper body? Anybody? Why? Why did God, why did Gaia, why did Mother Nature, why is the latissimus dorsi the largest muscle in your body?
To pull back your arms? I don't know.
Well, it is to pull back your arms.
Get extended.
Yeah, but how often do you do this during the day? I mean, gravity does this for me. I don't even need this muscle. I don't even use my lats to do that. Why is it the largest muscle in the body? In the upper body, upper body, upper body.
Is it because it's like covering like the axial portion or like the trunk, and it's such a like large mass, and it's like holding up your head but holding up your whole body?
I like it.
Kinda.
Yeah, I don't think that's correct, but I love the thinking. It's very creative. I really mean that. What's the hardest thing to do with your upper body? What's the hardest thing you've ever done with your upper body? How many pull-ups can all of you do? Yeah, me too.
Like 2.
Yeah.
Lifting.
Lifting your body up. If I am pulling my arms down, theoretically,
Yeah.
I might be on a tree or doing a pull-up or whatever. I am lifting my 220-pound butt up.
I think it's funny that you just said that.
What?
I think it's funny that you just said that because I was literally about to do some pull-ups too.
Yeah. So pull-ups are actually the hardest thing you can do with your upper body. So it takes the largest muscle to get that mass up. Right? Later, when we do the lower body, we're going to find out why your butt's big. Your butt's big because one of the hardest things to do is get out of a squat. Getting your body up. And your butt really helps you do that. You need a big muscle to do that. So when you are climbing, whatever, it takes a tremendous amount of power. And that's why it's the largest muscle in the upper body, because this is the hardest thing you'll ever do with your upper body. Yeah. Usually when I'm lifting stuff above my head, I'm not lifting a human body above my head. I'm lifting a can of soup, a weight above my head. This is 8 pounds. That's a lot easier than pulling down, which is really lifting up 220 pounds. So that's why latissimus dorsi is the largest muscle in your upper body. Cool, cool, cool. There is one other action it can do. By the way, it can extend, pull my arm down in front of me. It can pull my arm down from the side, adduct. It also says it can medially rotate. And this is hard to visualize. But if you think about it, this muscle attaches from here, from underneath your armpit. So when it pulls, it also medially rotates your arm. Can you see that? Because it pulls it from the inside. Remember, your deltoids are on the outside. They can pull your arms out. This pulls it from the inside. So it's as though somebody's grabbing from underneath my arm and pulling it in. That's the medial rotation. That's why you get bodybuilders where they medially rotate and flex their lats out. They're pulling on their arm to flex out their lats. Boom. I'd show you. You thought what? They were just stuck? Yes. I'd show you with my own lats, but I don't want to rip through this shirt right now. All right. So those are the 3 actions it can perform. And basically we just said very fancy stuff of it pulls the arm down to the body and it can pull my arm immediately rotated in. It's moving the arm, right? It extends, it inserts into the arm. That's what it pulls on. It pulls on the arm from the intertrabecular groove of the arm. The intertrabecular groove is just the groove between the 2 tubercles, the greater and lesser tubercle, intertrabecular groove. Now, the origins on this one, they make very confusing too. I'll try to help you with them. I like to go from backwards on these. So I'll explain that here in a second. Miss Bolotic, do me a favor, on page 71, go to the O. Go to the O and read off what it says there slowly.
For the Latissimus dorsi.
Yes, for the Latissimus dorsi. I want to know the origins.
Okay, so the inferior angle of scapula.
Perfect. Stop right there just for a second. Everybody, the inferior is the bottom angle of scapula, right down here. Okay? So this thing actually helps move the scapula a little bit too because it grabs onto it. Anyway, what's the next one, ma'am?
The spinous process of last 6 thoracic vertebrae.
Yes, last 6 thoracic vertebrae, which is T7, 8, 9, 10, 11, 12. Comes down into here. Keep going.
The last 3 or 4 ribs.
Yep, grabs on the ribs down in here too.
The thoracolumbar.
You did it really good, actually. Thoracolumbar or thoracolumbar. That was good though. Aponeurosis.
Aponeurosis?
Yes, or thoracolumbar fascia. I just see they changed the word, but fascia and aponeurosis is the same. You've got this big sheet of fascia back here that it hooks into too. I'll explain all this in just a second. And then what's the last part?
And posterior iliac crest.
Yes. The iliac crest is your hip bones. And they're just saying the back of your hip bones. This hooks into. So this makes a lot of sense, by the way. Those of you with little kids, really little kids, if you ever picked them up by the back of their shirt for fun, I'm not talking about being mean to them, and you kind of grab like their pants and wad up the back of their shirt, you can kind of carry them around, make them fly like Superman and stuff. Just me, so I was the only parent that did that. Anyway, you grab there because it doesn't hurt them. Well, if I'm climbing, and remember I said I'm going to get my big butt up there, I need a muscle that hooks to my big butt. So this muscle hooks to my lower back, and my middle back, and my hips, so that I'm pulling my hips up as I go up. That's why it has to grab onto a lot of my body to do that. So let me explain about all these terms they use, though. Actually, let's stick with this, because we have such a good thing. Anybody tell me what this upside down triangular bone is down here? Anybody?
Pelvic.
Sacrum. Yes, it is in the pelvic region, but it's the sacrum. Off the sacrum comes your hip bones. This muscle likes to attach to the posterior hip bones. And then something called the thoracolumbar aponeuroses, or thoracolumbar fascia. Thoro means thoracic, lumbar means lumbar. This is an area in here that's covered with fascia. It's a big, thick sheet of flat tendon back there to help give safety to your back. It's one of the reasons when you're doing deep tissue, you can drive into somebody's back so deeply. There's actually a lot of protection back there. And this fascia, this big sheet-like tendon back here, the muscle likes to grab into that. It likes to grab in to these last ribs down here, 3 or 4 ribs. And the reason I said 3 or 4 is on some of you it's 3, on some of you it's 4. We're not all exactly the same. It likes to grab on to the last 6 thoracic vertebrae back here. And then it also likes to grab on to the edge, the bottom edge of the scapula. And then it goes up into the arm, right up here. So, again, I want to break down the origins really quickly again, just so you understand the words they're using. This is the spine. These are hips. You're looking at the front of the person right now. We're going to look at the back because we're dealing with the back. This crest here, it's your hip bones. You can feel them. This is called your iliac crest. This is the posterior portion of your iliac crest as opposed to the anterior portion. This muscle likes to grab onto the posterior portion of the iliac crest. The thoracolumbar, the thoracic and lumbar aponeuroses or fascia. The last 3 or 4 ribs that are here. The spinous processes of part of your thoracic vertebrae, and then up into the scapula, and then up into the arm. So, hopefully you can all see the skeleton. Goes from the posterior crest of the ilium, iliac crest, posterior part, thoracolumbar aponeuroses, these ribs, T7 through T12, which is your last 6 thoracic vertebrae. Remember there are 12, last 6 thoracic vertebrae. The inferior angles of the scapula, and then it comes up, goes underneath your armpit, it makes your armpit, and hooks into the front of the arms. That's it. This should sound confusing just because of all the thoracolumbar aponeuroses, posterior iliac crest, ligamentum nuchae, all this new stuff that's getting thrown at you. The words. And I strongly encourage you to go back and find this stuff in your book on these skeletons. Don't just try to memorize posterior iliac crest. It's very important that you understand the posterior iliac crest is the back of your hips. You need to make that connection. Otherwise, you're just going to memorize words and you won't really be able to find them on a body. So it's very important that you can translate everything we're learning into your own language. So when I say posterior iliac crest, in my head, I'm actually thinking the back of your hips. That means something to me. I know I'm just using fancy words for that. Let's go on and look at one more muscle because I want you to be exposed to it before you have to take a test on this. By the way, these pictures, hold on, I want to show you something. These pictures on page 72, the stuff in black is the origin and the stuff in red is the insertion. It really kind of helps you see where the muscle gets sewn onto the body, so to speak. All right. Last muscle. It ends up looking like the top of Latissimus dorsi. It ends up also helping to make the back of your armpit, the posterior border of your armpit, and it's called the Teres major. Miss Monreal, on page 72, what are the actions of the Teres major? Under A.
On page 72?
Yeah, the actions of the Teres major. There's 3. Just read them.
It's actually on 71.
Of Teres major?
Okay, yeah, that's what I was
Oh, sorry. I'm sorry. I apologize.
Yes, on the bottom.
Yes, I got you. Okay. Thank you, Ms. Giannis.
Okay, so extend the shoulder, adduct the shoulder, and medially rotate the shoulder.
Cool. Can you show me extending your shoulder?
And thank you for whoever helped.
That was Ms. Giannis. She's on top of it. Can you show me extending your shoulder? You might be showing me right now, but your video is frozen. So, extending the shoulder, adducting the shoulder, medially rotating the shoulder. Miss Yanez, what are the actions for the latissimus dorsi?
Bend the shoulder, adduct the shoulder, and medially rotate the shoulder.
I didn't say the teres major, I said latissimus dorsi.
They do the same thing.
They do the same thing. Thank you very much, Miss Yanez. They do exactly the same thing, which is why we tend to lump them together. If you grab the back of the armpit, you're probably grabbing the lats and the teres major. And they both bring the arm down to the body. If they bring it down from the outside, that's called adducting. If they bring it down from the front, that's called extending. And they both reach underneath, so they both medially rotate the shoulder, the glenohumeral joint. They both do the same thing. Anytime you say latissimus dorsi, I want you to think teres major. Anytime you think teres major, I want you to think latissimus dorsi, even though they're much different in size, but they're kind of in the same area, and they do exactly the same thing. And we're not sure that one can work without the other. Like, I don't know that you can just flex your teres major and not flex your latissimus dorsi or vice versa. If you want to tell them apart, you have to really understand the origin and insertion of both muscles. So, Ms. Cooper, what is the origin of the teres major?
That would be inferior angle and lower 1/3 of lateral border of the scapula.
Yeah. So the inferior angle and the lower 1/3 of the lateral border of the scapula. The lateral border, lower 1/3. Now, latissimus dorsi grabs onto this too. But the way you can tell them apart is if you go up to the lateral border and you're still touching a muscle here, this is teres major coming out of here. It's not lat. It's actually, you can tell them apart. You can actually go to the lateral border. Latissimus dorsi isn't attached here. This is teres major. By the way, if you go up even higher, it's teres minor. But that's a whole other story. And Miss Felix Osuna, where does it insert?
The crest of the lesser tubercle of the humerus?
Yes. So the lats are coming up and grabbing in between these two tubercles, right? And this little teres major is grabbing to the crest right next to it. So from our point of view, they insert in the same place. They don't. It's two different answers, but they're like millimeters apart. So that's the other reason we lump these together, right? They both kind of go to the same spot. That's why they both do the same thing. Yeah? Okay. So, I want to ask you a couple really quick questions, and you tell me if this is the latissimus dorsi doing this action or the teres major doing this action. Tell me if this is the latissimus dorsi doing this action or the teres major doing this action. Miss Hunter, is this the latissimus dorsi doing this action or the teres major doing this action?
I'm pretty sure both of them are doing the action.
I'm pretty sure you're a genius. Yes. Miss Torres, is this latissimus dorsi doing this extension or the teres major doing this extension? Miss Torres? Miss Torres? You're frozen in time, Miss Torres.
Both. Sorry. Both.
I love it. Both. You are exactly right. Miss Nguyen. I am immediately rotating. I am immediately rotating. I am immediately rotating. Is this the teres major doing this? The latissimus dorsi doing this? Or the anterior fibers of the deltoid doing this? Or maybe all three.
Dorsi and them do same thing?
They do. It's definitely Latissimus dorsi and Teres major doing this. One can't work without the other. And also, it could be the anterior fibers of the deltoid doing this. All three would work together. Awesome. Cool? I think you guys are getting this. I think we're on our way. Awesome. Yay. So, we actually learned about 3 muscles today that help make up the posterior border of your axillary region. We learned about 3 of our 4 muscles today help make up the posterior border of your axillary region. That's a very fancy way of saying 3 muscles are the meat of the back of your armpit. Yes. What 3 of those muscles might that be, Mr. Kandaris? Mr. Kandaris, what are the 3 muscles that we learned about today that make up the back of your armpit, your posterior axillary border? Hint, they need to insert somewhere into the arm to do that. You have to cross over from the scapula to the arm to make a posterior border.
So wait, are you asking me to list the 3
Yes.
muscles?
Yes.
Oh, okay. Your Teres, your trapezius, your latissimus dorsi, and or what? No. Oh, are you wait? Okay, your face confused me.
Confuses me too.
Traps, your lats, and your deltoid.
But if
not the pencil deltoid Teres major.
So is that your final answer?
Yes.
I like that you put traps and Teres major together because they always should go together with any answer. And I can see how they would make up the rear axillary border. Can you explain to me how the traps attach to the humerus and make up the rear axillary border?
Oh, no, they don't.
Oh. Got it. So it might be the Teres major, lats, and deltoid. Yep. Right? The posterior fibers of the deltoid. Yeah. So when you guys reach up into somebody's armpit from behind, which you probably should not do to strangers, right? And we wouldn't poke up in there, but you could go up there and squeeze the back axillary border as hard as you want. In fact, I do really hard. I would be grabbing 3 muscles. We're actually grabbing more, but we've learned about 3 so far. I'm grabbing the latissimus dorsi, I'm grabbing the Teres major, and I'm grabbing the posterior fibers of the deltoid. Yeah? Yeah. Because a magic show here. Person, spine, scapula, humerus. There is no armpit here, because armpit needs a border. So, if we take the Teres major, that's starting to look like an armpit. If we take lats, that's starting to look like an armpit. And if we take rear deltoid, you've just created the back side of the armpit in the body. The posterior border of the axillary region. Yeah? Okay. That was a lot. That was really a lot. But I thought it was really important that we kind of break it down and kind of talk about stuff and think about it until it starts to become second nature. We're going to have to keep doing that. Yeah? Yeah. Okay. Any questions? Thoughts? Yeah?
How long is this test?
I have one.
You have a question, Ms. Torres?
Yes. So why do the Teres major and the Latissimus dorsi do the same thing? Why do we need 2 muscles that do the same thing, but the other one is really big and the other one is really small? Like, what is the thing behind it?
Okay, so I'm super glad you asked this question. So your question was, why do we have two muscles to do the same thing? And yeah, and why is one big and one small? Okay, so this question is actually quite brilliant on your part, but a couple things, and I don't mean this sarcastically. I mean I kind of do, but in a way, I'm trying to make an illustration here. One is, I'm not God and I don't know. Like, we're going to study lots of stuff that nobody knows for sure why, right? We know they're there, we know they do these things, but we don't know like the grand design of why there's two. That's one answer. So one answer is, I have no idea. The second answer is, some dude like me came along and said, hey, there's this big slab of meat coming up here, right, that attaches to the scapula, but then there's this other strand over here that attaches to the side of the scapula. I'm going to call one Tapscotus major and the other one Betty Lou. So you could argue that there aren't two muscles there, that somebody like me came along and decided to divide them up, right? It's kind of like when you eat steak. Filet mignon is not a thing. Rump roast is not a thing. A butcher came and cut up a cow and said, hey, when we use this back end and we cut here, we're going to call that a rump roast. And yes, it's basically the butt, but it's not exactly that. We've cut this other stuff and we're going to call it that name. So somebody came along and decided to call this Latissimus dorsi and the other part Teres major and made it two muscles. And you're going to see that with other muscles we learn about, where you're going to be like, why are we even calling these two muscles? Like, these are the same muscle. Because somebody decided that, oh, well, I'm going to use this border. It's kind of like when you look at the United States of America, and you're like, why is that border there? Well, a river was there, right? On the human body, sometimes a bone was there, and so we decided those are two different muscles. But sometimes we just divide them up arbitrarily, just like we do with states. Sometimes we're like, nah, we're just drawing the line here. So to answer your question is, maybe they're not two muscles, right? Maybe they're, they're really not. But they've decided they're kind of separate and such. The third answer to your question, first was, I'm not God, I have no idea what I'm talking about. Second was, somebody like me arrogantly came along and named these muscles and might have made two out of one. The third thing is, your body is amazing and does very intricate actions and needs different muscles to pull slightly different ways. So even though we say both these muscles adduct or extend the arm, they might do it from slightly different angles, and that matters. If my two arms are muscles, even if they're very close together, when they pull, they're going to move this pen slightly differently. And by having them slightly different angles, I can move this pen slightly different ways. Both are coming towards me, right? My arms still come towards me here, but by having tiny different muscles in slightly different places, it allows you to get slightly different movements. And if you've ever seen the incredible things people do with their bodies, ballet, breakdancing, running, pole vaulting, skydiving, playing the piano, all these things take extremely minute actions. They're not doing this. No, they're doing these incredibly fluid, perfectly controlled motions. And that might require slightly different muscles pulling from slightly different areas. And so that might be the point. Yeah.
Well, I'll go for the third one, because if it's there, it's for a reason. We just don't know exactly what reason, but I know God is so smart and he put it there for a reason.
Yeah.
So I think the third one is...
Yeah. Oh, I have a fourth answer I forgot to tell you too. Speaking of your God is so smart theory, you have backups. So like when they send the spaceship to the moon, they have redundant systems, because if the oxygen system breaks, they need another one, because they don't have any spare parts up there. They need something running. Your body does too. So your body has more than one muscle basically that does everything. And so if you have a problem with one muscle, another one can kick in. You've got backup systems in your body, which is super helpful in case you ruin one. So if you tore one of those muscles a little bit, another one can kind of take over for it. So you have redundant systems, you have backup systems, you have almost every movement in your body is done by more than one muscle. We just learned 3 muscles today that medially rotate my shoulder. 3 muscles. Medially rotate my shoulder. That's my 4th reason. So God gave you backup systems. Any other questions? Good. All right, I'm going to ask you what you learned today. And if you don't have anything to share, I'll just ask you origins, insertions, and actions of muscles. Yeah. Okay, Mr. Kondaris, tell me something you learned today, sir. Or something you want to remember from today. It doesn't have to be something you learned. Something important.
The trapezius is not included in that auxiliary connective area you were talking about.
Yeah, okay. That it does not make up the posterior axillary border. Cool, cool, cool. Gotcha. Okay. Miss Nguyen, something you remember from today?
Yeah, I learned today have in the deltoid, have in the three pyre.
Yes. So the deltoid has 3 parts. What are the name of those 3 parts, Miss Nguyen? Anterior.
Yeah, and
Middle.
Medium pyre and
Posterior.
posterior.
Yeah. Good job. Thank you. And what she just told us is important because those 3 parts actually do 3 different things. Like you could have named those 3 different muscles if you wanted to, right? They do 3 completely different things. Yes. Miss Hunter, anything today stick out in your brain?
Hey, I learned that the lats and the teres major are the same.
Thank you. That's actually...
or at least they provide the same actions.
Yes, thank you. Yeah, you said it perfectly. They're obviously not the same, but they provide the same actions and they're kind of in the same area when we look in the armpit. And yes, thank you. Anytime I say teres major, you say latissimus dorsi and vice versa. Thank you. That's exactly what I want to hear. Miss Felix Osuna, tell me something. Something.
I find it interesting that the deltoid, the Latissimus dorsi and teres major have the same actions.
Okay. What are those 3 actions?
Extending the shoulder, abducting the shoulder, and rotating the shoulder.
Thank you. Cool. Miss Cooper. Miss Cooper, tell me something from today. You've frozen, so I might come back to you. Oh, no, you haven't frozen. Okay. Miss Cooper, can you hear me? Hi. Something memorable from today.
I learned that dorsal means back.
Yes. Good. And so latissimus dorsi essentially means what?
It means lateral back.
Yes! It's the big muscle on my back on the lateral side, the lateral back muscle. Thank you. Thank you. Miss Yanez?
I learned that the deltoid is scapula, but it doesn't move the scapula.
Yes. Now, by the way, Miss Yanez, I admit that if I locked my arm down on something and then I moved my deltoid, like if you glued my arm to the wall and then I moved my deltoid, it would pull the scapula. Does that make sense? But we normally talk about movement in relationship to the body. Yeah. Good. Cool. Miss Monreal, what did you learn today?
That the origin is usually there's no movement, and that the insertion is where there's the movement.
Thank you. The origin is usually the anchor, and the insertion is usually what's getting moved. Yes. And I love that you said usually, because it's not always the case. right? So with the traps, the origin is my head here as part of the origin, right? But in some cases, my head can move this way, and so my head becomes the insertion in a way. So yes, well said. Thank you. Miss Stanley.
I read on one of the pages about the deltoid that it's like an antagonist to itself.
What does that
That was
mean?
kind of cool. It's like when you're like shaking hands with somebody and you placed your hand on it, you can feel like fibers kind of like shorten or something. It's kind of hard to describe it.
So, antagonist means that it pulls in the opposite direction. And so most muscles can't antagonize themselves, but the deltoid can. And what they mean by that is it can fight itself. So my anterior fibers could be causing a flexion. What can my posterior fibers do?
Extension.
Yes. And if they're both doing it at the same time, they are antagonizing each other. They're fighting. Yeah, thank you for bringing that up. That's very cool. Very cool. And as a massage therapist, you care about that because it means when the front fibers get tight, the back ones might be getting tight to fight it, and so you want to loosen up both sides. That's why that's important. It's super important. Thank you for bringing that up. Miss Hanson, anything stick out in your thoughts today?
The latissimus dorsi, the Teres muscles, and the deltoids have similar insertion points.
Similar insertion points?
Yeah. So they're not quite the same insertions, but they're close together.
The Teres major and the latissimus dorsi, but not the deltoid.
Right. It's still in the arm though.
It is, and they all move the arm. But just like from a kinesiology point of view, everybody, the lats and the Teres major attach up here. The deltoid attaches down here. This is a pretty big difference. So, but you're absolutely right. They all move the arm. Absolutely. Thank you. Miss Melodic. What stuck out in your head today?
That one of the origin points for the trapezius is like up in the skull.
Yes.
I expected it to like stop at the spine.
Yeah.
But I didn't know that it went all the way up to the skull. So.
What do we call that spot that protrudes on the back of the skull, kind of externally, in the occipital region?
External.
Occipital.
Occipital protuberance.
Yeah. By the way, that was fantastic. I've been doing this for 25 years, and you listen to me carefully. You'll hear me mess up quite often. External occipital protuberance. Fantastic. Thank you. Miss Petrie.
The nuchal lines.
Yeah, where do I find the nuchal lines?
Line.
Superior nuchal lines.
Occipital.
Yeah. Yeah, if you find the external occipital protuberance, the nuchal lines come out of the side of it. We just think of them as kind of bumps in the back of people's heads, but those bumps are there so that muscles can attach to them. And your trapezius happens to attach to the middle, the medial part of those superior nuchal lines. And by the way, if there's superior nuchal lines, you know for a fact that there's inferior ones. Otherwise, they would just call them the nuchal lines. But yes, well said. Thank you, thank you, thank you. Miss Harper?
The deltoids hold the arms and the trapezius hold the scapula. Is that right?
That is right. I just wanted to think for a second. I'm so sorry. Yes, that is right. Trapezius moves the scapula. The deltoids move the arms. Yep, well said. And they often work together, but you're 100% correct. Thank you. And Miss Torres, last but not least, what?
For me was the superficial fibers that originate on the lower back. I always thought that was a muscle. Like I didn't know it, like its own muscle. Like, you know? And they're fibers. There's like the fascia thing.
Oh, the thoracolumbar aponeuroses.
Yes.
Yeah, everybody, this
like
is actually very important. You've got a big aponeuroses on your tummy, and you've got a big one on your back, and they help support your body. This is called the abdominal aponeuroses or fascia, and this is called the thoracolumbar, which just means thoracic lumbar, thoracic with lumbar, thoracolumbar aponeuroses. And a lot of stuff ties into these two areas that we're going to learn about later that kind of holds my middle section together. Yeah, thoracolumbar aponeuroses is actually really important, and lots of muscles weave into it back there. Just weave into it in this big kind of spider web back there in your back. Cool, cool, cool. Okay. Any other questions? Yes? No? All right. I have released the test. I was hoping we'd get to it in class, but we're not. It's not terribly long, by the way, to answer Miss Petrie's question. It's 29 questions. It's 29 questions you'll have to think about. You can't retake it because I want you to think. That's the only reason I'm doing that. I want you to think. And I'm available for tutoring. So if you were privately lost today and didn't want to say anything, send me an email and we can do one-on-one tutoring. I want you to understand this stuff. If you're only mildly lost, don't worry. You're supposed to be mildly lost right now. It's a lot. It's a lot. So if you're feeling like, yeah, I'm kind of confused, but I understood some of that stuff, yeah, you're probably okay. See how the test goes. Anything else? I look forward to seeing you all in lab. What we're discussing today, what?
Would there be a test and homework, or is the test homework?
The test is your homework. I was going to give other stuff, but I don't want to do it now that I don't want you to double up. Just focus on this. If we would have gotten this done, you're right, I would have given homework, but we didn't. So just this test, just 29 questions. 29 little questions about these four muscles. Cool? Feel free to use your book, whatever you want, because it's really just getting you to think. Cool? All right, everybody. I will see you at lab. Thank you for participating with me. I really do appreciate it. Yes. And have a great day until I see you. And I mean, have a great day after I see you, too. Bye, everybody.